Yeah. Hello, everyone.
Hello, good evening.
We're hitting the go live button in all of our different spaces. Right, we're going on Instagram now. All right, we're live on Instagram. Now let's go on over here to Facebook. See if we can
Hello,
get that one.
IG.
All right.
Hello, Facebook.
Yes, we're doing it. Isn't it
Yes,
fun?
welcome, everyone.
Okay, so I hope everyone has had a great week thus far because, yeah, the week is almost over and
Yes.
we are excited that the weekend is coming and we're going to be able to rest, I hope. I don't know about you, Vanessa. Do you have dance this weekend?
We don't have competition. She does have a class on Saturday morning, but other than that, and they have a dance. So Saturday is still a little busy, but for the most part, it's not my typical weekend.
Gotcha. So I'm going to try to put these reading glasses on because going the back and forth from regular to reading has been an interesting thing, and it's still not working. Okay, so today we're going to be talking about atrial fibrillation. Okay, as we are practicing or actually participating in Cardiovascular Awareness Month. And so I thought that bringing up atrial fibrillation would be a good idea because of the fact that there are so many people, especially on television and such. You've seen Kareem Abdul-Jabbar talking about his bout with atrial fibrillation, and if I remember correctly, Venus Williams, the tennis pro, she had an issue with it also. So it's something that is common, and it's something that we need to make sure that you all are aware of symptoms to actually look for. And we also are going to talk about, support for individuals who have cardiovascular conditions, because we need, excuse my phone, we need to make sure that we know the warning signs in our loved ones or in friends, neighbors, so we can also help in those situations. So atrial fibrillation is an irregular and often rapid heart rhythm. Okay, so sometimes it's can be where you're sitting there and it's normal, and then all of a sudden you get up and it's like, and you're like, whoa, what just happened? But something changed, and it is irregular because, normally most people are used to a heartbeat that's maybe low, maybe faster, it may be, but just the whole consistent part of it actually being normal and consistent. Where with atrial fibrillation, you may have your, like I just said, or you may have something like, so think about how your body would respond when your blood is flowing at different rates, and if your heart is not pumping properly as it typically isn't doing when you're having atrial fibrillation, you run the risk of the blood not flowing through your heart. You run the risk of the blood actually staying stagnant and maybe having clots And then when you have clots, those clots can go other places. And if it goes other places, it can create problems. So let's say you have a clot in your heart. Yes, you can have a heart attack from an atrial fibrillation, but it can also travel somewhere else, cause a stroke, cause just the flow to your legs and your arms to be decreased. So just know that it is something that is very serious. Okay. So don't just be like, whoo, I'm just getting old. No, you're not just getting old. Something is not right if your heart rate is actually doing some of the things that I just did. And I'm sorry if I caught y'all off guard with the actual clapping, but I just felt like we needed to give you an example of how you may feel, you know, what you may feel as your heart is going. So typical symptoms of atrial fibrillation, it could be like that, the palpitations, it could be chest pain, it could be dizziness, it could be fatigue, lightheadedness, reduced ability to exercise, shortness of breath, and weakness. Okay. And that all makes sense based on what we were talking about, because you're not having that proper flow of blood and oxygen going where it needs to go. Okay. So people who have atrial fibrillation that lasts for more than, you know, a spell or such, they may be placed on some actual medications. And they're also saying that the causes of atrial fibrillation, it could be known that the upper and the lower the upper chambers of your heart is the atria. So that's what we're talking about. So the upper chambers of your heart is having problems. So it's not getting the blood out of your heart. Okay. And then also you have the lower chambers, which is they're the ventricles. So causes of atrial fibrillation could be that you have a congenital heart defect. So that means you could be born with something that causes your heart to have that irregular heart rhythm. You can have what they call sick sinus syndrome. Is when your heart, which is the natural pacemaker, it doesn't work properly. Sleep apnea. And I know there are a lot of people who don't like to wear their CPAP, but just think that can cause problems with your heart if you're not wearing your CPAP. And then, you know, your heart attack, you can have heart valve disease, high blood pressure, pneumonia, because you're having problems breathing. So that's going to cause some issues. You could have blocked arteries that's causing the problem. And you could have thyroid disease, an overactive thyroid, or infections from viruses. Okay. Lifestyle habits that may cause atrial fibrillation is drinking too much alcohol or caffeine. Those are stimulants. So it could cause problems for you as far as atrial fibrillation, illegal drug use, smoking or using tobacco, or taking any other medications that have stimulants in it, like cold medicines and allergy medicines that are bought without a prescription. If you don't take it the way it's supposed to be taken, or if you take it and let's say you have your own medication and you're not supposed to take those type of cold medicines with your medications that you're on, but you decide, well, I'm just tired of sneezing and I'm going to take it anyway, you are putting yourself at risk for having issues with atrial fibrillation and also high blood pressure too, because there are some actual medications for colds that people with hypertension only take. Okay, because there are certain I'll have to have Kendrick on here. He's our pharmacist. There are certain ingredients in average cold medicines that people with high blood pressure can't take. So if you ever see that commercial, don't think that people in this instance are trying to just make you pay for this and get an extra medication, maybe pay a little more. No, it's not that. It's truly because the medicine that's for persons who have heart disease are being removed. So those that there's a conflict, they're removed from these actual cough medicines and such. Like I'm not endorsing one, but like Cocedin, that's one. If you have high blood pressure, that's one that you can take. Supposedly.
Keisha, are these prescribed or are they over the counter?
These are actually over the counter, so that's why they're even more dangerous.
Okay, so I wouldn't even know if I wasn't being educated right now, or my doctor making me aware.
Right. Because you definitely have to monitor your blood pressure, because you don't want anything that's going to increase your blood pressure while you're sick. You're already not going to be feeling well, okay? So that's going to run the risk of something affecting your blood pressure. But then when you add the medication, then
so I'm just going to say I'm going to add this tad bit to that with, it made me just a light bulb go off and say that this is why it's also important for us to make sure that we're reading the labels and the ingredients, because if I used to always take this medicine before, but now I have a condition, then I need to make sure that I'm taking the proper, and it's not wild, but like it's simple as a cold medicine that I could be putting myself in harm's way. So
exactly. And they're saying risk factors for atrial fibrillation are your age. As you get older, you're more at risk for things, especially if you are not living a healthy life. Caffeine, like I said, nicotine, the legal drug use. Yes, that's pretty much with everything, because let's be real. Caffeine, we talked about being a stimulant. Nicotine can constrict your vessels, and then illegal drug use, you don't know what they're putting up in those drugs. So that definitely could cause a risk factor, because they cutting it with whatever. You don't know what it is. Okay. So changes in your electrolytes. So someone like me, I get dehydrated easily. It's like if I just breathe wrong, I'm dehydrated. So I need to make sure that I am replacing those actual electrolytes, because if I don't, that could affect my heart, my body. Everybody know the common one: get cramps in your hands and your feet and all that. And the older you get, it seems like the more they hurt. But you need to make sure that if you are working out or doing anything that's causing you to lose electrolytes, that you're making sure that you're replacing those. Also, if you have a family history, you can have a risk, because your family history could be any of those factors that, people, your family have heart conditions. They have all different things. So it could be linked to you by genetics and also by social and trends. If that's all you eat is stuff that's bad for you, and that's what your family does, you're putting yourself at risk. Okay, so that's another way to consider it being a family history, because the family is not changing up their eating habits or their health habits. Okay, so obesity is pretty much a risk factor for most things. And America as a whole, we are overweight, and we need to work on more exercise, eating better, getting the right amount of sleep, because that's very important, and long-term health conditions. So we got diabetes, we got chronic kidney disease, lung disease, sleep apnea. So think about all of those things. So we have to try to keep everything in line. So if you keep everything in line, you'll decrease the chance of complications from most health conditions. And then thyroid disease. If your thyroid is not acting properly, your body's not going to adjust well. And this could also cause problems with atrial fibrillation. Now, as far as complications, the blood clots that I talked about can cause stroke. Okay. And then, anytime something is killed, so like in a stroke, you can't get that back. You can try to adapt to a new life, but just think, the clot is stopping. The clot born from the atrial fibrillation is stopping the flow, stopping the oxygen, killing off the area where it is. So other complications, diabetes, heart failure, and sometimes valve disease. So for prevention, and then I'm going to let Vanessa talk, is control your high blood pressure, your cholesterol, your diabetes. Don't smoke or use tobacco. Eat a diet that is low in salt and saturated fat. And like they say in church, if you can't say amen, say ouch. Exercise at least 30 minutes a day on most days of the week, if you can. Get the sleep, like I told you, maintain healthy weight and decrease your stress. So that is my spiel on atrial fibrillation. If you all, you have questions related to that, you can feel free to ask those questions and we will try to answer them. But I'm going to give it over to Miss Vanessa now.
Okay, thank you, Keisha. That was great information. I learned something just listening to that information. As I said, making sure that something as simple as cough medicine, cold medicine, that we're making sure that we know what's in it and we're taking what's best for us and our health conditions. So I appreciate that. And so we're going to talk about how we, caregivers, loved ones, friends, family, can support people with cardiovascular diseases, different ones. So most important is what we're doing tonight, and that's educating yourself about their particular cardiovascular disease. Making sure that you listen to their concerns, encourage healthy lifestyle changes, help manage their medication, assist in daily tasks, provide emotional support, and ensure that they follow their doctor's recommendation regarding activity levels and diet. And also making sure that we consider taking a CPR course, just in case there is an emergency accident or anything like that, so we can be aware. So the first one is learning about educating yourself about their condition, making sure that we understand the specific conditions, terms, problems with their cardiovascular disease and the complications that may come with it, and treatment options and medication that come with those. So making sure that we can help support them to our best ability, and helping sometimes, especially if they're our parents who may be in upper age and may have some type of form of dementia or memory loss or anything like that. So we want to make sure that we can help them understand this condition that they have. making sure that we're open to communication, that we're listening to their concerns, especially if it's very new and they never had high blood pressure or any type of heart disease or any other medical condition, and this is something that's very concerning to them. So making sure that we're open and we're listening and we're encouraging them doing this. Helping them with lifestyle changes. We know that especially when it's generational, we know in our culture, in brown cultures, Blacks, Hispanic, we know food is how we say I love you. If the family is coming over, if grandma's coming, aunt, anyone from, coming down to visit, we're cooking up a feast for everyone to sit around, to laugh and enjoy. So when we've done this with great grandma, grandma, mom, and aunt, uncles, so when we have to make those life changes, it can be difficult. It can be very challenging for those individuals. So making sure that we're supporting them in that. And also with the different diets, also exercising, and how we can do that is, especially if you're in the same household, then we can take on those dietary restrictions ourselves to making sure that, if mom can't have a bag of chips, I'm not over here and eating her favorite Doritos or with all this sodium in it. So I'm not going to eat that. I'm going to get something else, some veggie sticks, something with some little light ranch or something, like something where I'm supporting them and I'm encouraging this lifestyle change. Exercise is very important when we're doing our lifestyle changes. So even if it's something simple as walking, I'm gonna come over. If I don't live there, hey, we're gonna walk at 6 p.m. before it gets dark. When it's cooler out, in Texas, we can get really hot in the summer. So when it's cooler, not that much cooler, some days in the summer, but it's cooler, or as this week has went, as the day progressed, the temperatures got a little warmer, so we're not at 17 in the morning. So just making sure that we're being a support system, that we're being a team player, that we're being a partner with our loved one, our friend, our family member, when they're trying to change their lifestyle and do what's best for them. The next one is helping them manage their medication. As Keisha just told us a while ago, just something as simple as cough medicine or cold medicine, making sure that we're reading those labels, making sure that if they take any other medication, that it's not messing with that, or it's not decreasing the effectiveness of that medication. Sometimes it's not about taking the medicines together, but at the same time, like I know at one time I was taking some medicine, I had to take them 4 hours separately. So I could take them together, such as I didn't have to stop taking one to take the other one, but I couldn't take them at the same time. So it may be something simple as that, and making sure that our loved one understands that, okay, if I'm taking this blood pressure medicine, I can't take this other medicine until 3 or 4 hours later, or whatever the case may be. Making sure that we're assisting them in their daily tasks. Like I was saying, even if it's, when we're doing these lifestyle changes, I'm gonna come over and we're gonna cook together. We're gonna learn how to change. For me, I know not cooking with salt is something. Oh, Lord Jesus. I'm gonna say somebody needs to come over and help me how to do that. And I'm just being really honest. That salt gives it so much flavor. It's part of the Bible. We're the salt of the earth. So when I'm seasoning my food, I think the same thing. But I know if this happens to me, I am really going to need assistance with that, because I've been cooking since I was very young. And my great grandmother taught me how to cook. So, baby, we seasons food, and salt is a main season. So I would definitely need to have some assistance with that. So I wouldn't be a good support system in helping someone not come over and cook and not use salt. But I could definitely dice up some veggies and have a fruit tray for them. But it's just things like that. Um, then practical assistance, emotional support, making sure that we're understanding, we're supportive of this new diagnosis or this new journey that they are having to take. And then respecting boundaries. And sometimes this is hard, especially, I'm going to just be honest, for our culture. We think because we daughter, we mama, or we sister, or we brother, we can be all in the business. Not necessarily. We cannot be in the business. And, you know, a lot of times we have to adjust, especially when it's a new diagnosis or something unfamiliar. Sometimes we have to process it first before we can give it to someone else or even get your feedback or your knowledge on it. And you could be an expert on it, but until we've processed and we've come to term with this new normal, sometimes we have to be patient with our loved ones, and accept that, you know, their boundary is not right now.
Mm-hmm.
And, you know, respect that and honor it. And then the next thing is making sure that we are CPR trained, that we are CPR certified. So if an emergency does arise, we know how to help our loved one. And I know when I first had my children, I had to become, before I left out, and I don't know if it was because my baby was preemie, but I had to become CPR certified for children before, for an infant, before I left the hospital with her. So that is something that we definitely need to make sure that we do. And we also need to seek support. If it's becoming overwhelming for you as a caregiver, seek support. Ask other individuals who are going through the same thing with their loved one. There are a lot of support groups. We're here. And whether you, and get that information, because you need to make sure that you're taking care of yourself so you can continue to take care of your loved one. And that's pretty much it on how you can support your loved ones. I have some things that you can look out for, symptoms, just in case you're when you're managing and your family member, and if there's heart failure, shortness of breath, fatigue, leg swelling, feeling faint or lightheaded, dizziness. You can just make sure that you're helping them monitor. Also, another thing is if they're gaining weight, they could have fluid on them, making sure that you take their blood pressure, investing in a blood pressure machine, and you can get them for fairly cheap at CVS, Walgreens, Walmart, any store that carries devices like that. And then making sure that also that you attend their doctor's appointments with them. Because sometimes, you know, especially when they have been very independent, and this is a new normal, we're not always honest. You know, oh, no, we're okay. We don't have any problems, even though, you know, you could barely breathe this morning. Oh, but now it's 2:00 and I'm good. My appointment, I'm good, doctor. Oh no, you know, I ate something, you know, it was probably what I ate is why I couldn't breathe earlier. So making sure that you do those check-ins with them and with their doctors, and ask them what their doctor said, And then just with their nutrition, making sure that we're adding more fruits and vegetables, whole grains, unprocessed food, plant-based protein, lean cuts of meat, um, and then eliminating a lot of high processed foods, um, foods high in sodium, um, all that extra added sugars and trans and saturated fats, and minimize the alcohol as much as we can. So those are all things that you can help your loved one. And as always, making sure that they are good emotionally and mentally. And if they're not, help them seek professional help. So that is how we can support our loved ones with cardiovascular diseases.
I have a support for you.
Right.
When my son was, diagnosed with hypertension, we went into hysteria. And I went to a spice shop. And there are spice shops that actually have different seasonings already packaged together that don't have the salt in them. So it'll help you already be able to cook something that's flavorful, but without the salt.
Okay, so I will definitely need that.
All kinds of different, like, I'm gonna just be real, I'm the rice and gravy queen, that's the kind of stuff I used to cook. And then now it's like thyme and coriander, however you say it, and mustard, mustard, is it mustard powder? I think
okay.
But yeah, different things and it tells you what these spices are best for, if it's best for pork, if it's best for chicken or whatever. But it really helped us not use the salt as much because it was given different flavors that made up for the fact that there was no salt. Because at first I was like, I don't know if I'm being able to do this. But
I know that's where I am right now.
I'm not going to say that I don't use some salt, but I do. But what I have started doing is getting the seasonings that they have like the bolder flavor. Like there's we can talk offline, but there is a garlic powder that a woman who taught a small business class that I was in, she makes. And when I tell you, you don't need salt when you have her OG garlic powder. So, like I said, I'm learning now, since I'm half a century, to to look for things that's going to help me stay around for a while. And the family bought into it. They eat it. And they don't complain about it. So that's another thing. It's not like we're eating it and we're just like, oh my God, we're eating this, but we really don't want it. It really is flavorful. And the other thing I have on a banner scrolling across, when we're talking about CPR, and we are in talks about possibly offering CPR classes in different cities. So if that is something that you're interested in, contact us on the Dear Encourager website. There is a contact us area. It'll send the email to us, so we'll know where you are and see, if we can help in those areas. Not gonna lie to you, right now, if you are not in Dallas, Austin, or Alexandria right now, your classes may be later in the planning, but we want to at least try to offer that to everybody. So in case something happens with our family members, we won't panic and we'll know what to do.
That's right.
So, yeah. That's all we got for today, I do believe.
That is all.
I hope.
But
Go.
I was gonna say what you just told me, and it just said da 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 da. I will be looking out and seeking a chef, a cook, someone who can show us and would be willing to come on here and educate us on how to cook tasty, great meals without using that much salt. So I am going to request that. And while, if anyone knows, while I'll be doing my own seeking out and researching. So
okay, sounds great. I'm ready to learn some more because you know people get tired of eating the same stuff over and over again too. So. Well, everyone, thank you so much for joining us tonight. But please remember to contact us if you're interested in a CPR class. Oh, I forgot something very important. One of our board members and my brother, Kendrick Rosenthal, will be running in the 2025 Atlanta Publix Marathon. And he is actually running as a fundraiser for Dear Encourager. And I have placed it on my page, and Vanessa, feel free to.
I will be putting it back on mine. Yes.
Okay. And there is a link to donate. So we would really appreciate if you would support Kendrick as Kendrick is supporting us. Okay. So yeah, let's, and it's like 10 days away. So he's been training and preparing for it. And we are very thankful to him for this because his sister would only be probably on the sidelines going, yay! I'm not going to be running. But yes, please, if you are led, please support that endeavor. Yes. All right, everybody. Thank you again. I'm really going to say goodbye now.
Good night.
Good night. If I can get these things to work.